Hello everyone, I am Dr. Rimpi Foujdar, currently working as an assistant professor in the Department of Food Technology, Haldia Institute of Technology. Today I am going to give a lecture on application of spices in human health. It is very well known to all that the risk of disease is increased day by day due to, and we are witnessed from last 5 years about the threat of COVID virus, and also apart from contagious disease, the other life-threatening diseases such as cancer, cardiovascular disease, arthritis, or Alzheimer disease. These diseases are increased in recent few years. It is mainly due to the contaminated food or irregular daily life, and therefore the peoples are more concerned about their health and want to incorporate the healthy food products which actually reduce the risk of those diseases. If you review the past few years data, you found that the people's want to incorporate the healthy food products such as organic food, herbal tea, gluten-free product, etc., and the gluten-free product. That's why I have taken this lecture, the application of the spices in human health, because spices is one of the well known to their health beneficial effect. And to in this today lecture, I'm going to cover about some spices, their bioactive compounds, and their health beneficial properties. So what are the spice? What is actually spice? Spices is basically an integral part of culinary cultures around the world and have a long history, which is used for coloring, flavoring, preserving food, and medicinal purposes. And these spices are known to their health beneficial effect because they protect against the development of many acute and chronic non-communicable diseases, and thus it helps to maintain the people health. As per US National Health and Nutritional Examination Survey, it was found that 5 to 10% of adults in the United States use botanical supplements such as spices for health benefits, and such increased in the use of those spices and herbs is basically due to they are non-toxic, or there are no side effects, and also they are known their health beneficial properties. Here I have shared data of a study, and where the 703 people are taken as a individuals, and percent of individuals has been taken who believe that a certain spice can promote health and wellness, and it has been found that ginger is one of the most preferable spices which exhibit the health and wellness effect. Apart from that, most three common popular spices which is preferable by the large amount of people are ginger, garlic, and cinnamon. And next is the chili pepper, turmeric, cilantro, cloves, black pepper, curry leaves, and fenugreek. But most of the people agree that ginger, garlic, and ginger are the most promoting health and wellness effect, and after ginger, garlic, and cinnamon. So the health beneficial effect is basically due to the bioactive compounds present in the spice, and the terms is bioactive compounds is means that they bioactive means they have certain health beneficial effect. That means exerts a bioactivity. So bioactivities is basically exerts by the bioactive compounds, and those bioactive compounds present in spices are sulfur containing compounds, tannins, alkaloids, phenolic diterpenes, flavonoids, and polyphenols. And the bioactivities basically are antioxidative, anti-inflammatory, anti-tumorigenic, anti-carcinogenic, and glucose and cholesterol lowering activities, cognition and mood regulation, that is actually neuroprotective effect. So here I'm going to discuss, that is the on overview on selective spices, that is ginger, garlic, cinnamon, and turmeric. Here use here I have taken because turmeric is one of the most recently researched topic, because turmeric has an enormous health beneficial effect, especially regarding cancer preventing effect. So here I am going to discuss this spices, selective spices. Ginger is so first is because the ginger is considered as the most of the people that is promotes the health and wellness. So ginger, the bioactive compounds which is responsible for those bioactivities is basically ginger contains gingerol, soyagols, paradols, and gingeron. So gingerols are the major pungent compounds which is found in ginger. Mm, and the health beneficial effect of ginger, there are many health beneficial effect. Among them, ginger help to reduce the nausea and vomiting. And the study shows that the study clinical trials is available. We show the ginger 1 gram per day may be safe and effective to decrease the nausea and vomiting during pregnancy. Apart from that, it also helped to reduce the nausea and vomiting due to motion sickness. And one another study showed that 500 mg oral ginger 1 hour before surgery in women helped to decrease the severity of post-operative nausea and vomiting. Another health beneficial effect of ginger is antioxidant and anti-inflammatory effects. Antioxidant is basically that means it scavenger the free radicals. These free radicals are basically produced during metabolic activity in the body, and these free radicals are known to pathogenesis of many types of diseases, including cancer and cardiovascular diseases, arthritis also. So antioxidant effect, certainly it reduce those diseases also. Apart from its have anti-inflammatory effects, because it inhibits the production of inflammatory mediators. If inflammatory mediators, basically, if we take example of one osteoarthritis disease, in osteoarthritis disease, there is an increment in the inflammatory mediators that is named as serum levels of TNF alpha, inflammatory cytokines, tumor necrosis factor, and interleukin 1 beta. These are inflammatory mediators, and the actually in a recent the clinical trial showed that osteoarthritis patients who received capsules containing 500 mg of ginger powder for 3 months helped to reduce those inflammatory mediators. So, what is actually the term I have used? Osteoarthritis is a degenerative joint disease in which the tissue in the joint break down over time. It is the most common type of arthritis and more common in older people. Apart from those health benefits, another health benefits of ginger is it helps to maintain the cardiovascular health. Already we have showed that ginger has been reported to have anti-inflammatory and antioxidant effect. Apart from that, anti-platelet, anti-hypertensive, and hypolipidemic effects is also exhibited by ginger, and that's why it maintains the cardiovascular health. Here I have given one case study, that is a study showed that 3 gram per day ginger for 45 days, which helped to lower the blood levels of triglyceride, cholesterol, and LDL, that is low density lipoprotein. This is bad cholesterol, and at the same time, it increased the good cholesterol level, that is the HDL, high density lipoprotein. So these are all actually responsible to maintain the cardiovascular health, and that's why the ginger help to maintain the heart health also. Apart from that, another ginger health beneficial effect is joint, and it maintains the joint and muscle health also. The study showed that the ginger reduced the joint swelling, cartilage destruction, and serum levels of inflammatory cytokines. These are all associated with the rheumatoid arthritis. And rheumatoid arthritis is basically joint and muscle pain, and this is and from this data it has been suggested that ginger help to reduce ginger actually help to reduce the pain which is associated with the rheumatoid arthritis. Ginger also showed the anti-glycation and anti-glycemic effects. It has been actually observed that accumulation of advanced glycation in products. It is actually the result of non-enzymatic reactions between the proteins and sugars, and this is cause the aging and diabetes. So ginger inhibits those ages formations, and therefore it prevents the diabetic complications. So some studies are here I have given. So in vitro studies showed ginger extract could prevent or inhibit this protein glycation process. And in randomized clinical trials, the supplementation of ginger, that is 1.6 to 3 gram daily, which improved the insulin sensitivity. So insulin is one of the insulin is one of the cause insulin resistant, or you can say the non-working of insulin is one of the cause of diabetes patient. So it actually improved the insulin sensitivity, and thus they actually maintain the diabetic complications. We have observed that a number of health beneficial effect present in the ginger. Apart from ginger, the garlic, another spice which is known due to their health promoting effect. So here I have given the chemical constituents which is present in the garlic, and which is basically responsible for health beneficial effect. So most common biological effects compounds are allicin and ajwain. Apart from that, other organosulfur constituents such as S-allyl, L-cysteines are present in the garlic. And in case of garlic, raw garlic, whole garlic, the allin is found predominantly, which is cleaved by allinase enzymes. And when garlic is crushed or chopped, this allicin is formed. And this allicin is basically found to be the compound which is most responsible for the hot sensation of the raw garlic. If you notice that in home, if you consume the raw garlic as a whole, so there is no flavor. Okay, because that actually the allin is cleaved by allinase. So allicin is basically responsible for hot sensation and flavor also. So when it is crushed, the flavor will come. So allicin, that's why. But this allicin are further unstable in aqueous solutions, and this is decomposed by non-enzymatically to other different sulfur compounds, which are also known as they are actually known as bioactive compounds, or they exhibit certain biological activities also. So apart from that, when the garlic is actually in the presence of water, aged garlic, the allicin is converted into the that is SAS, which I have already S-allyl cysteine. So that is actually that is another bioactive compounds which is considered as which exhibit different types of biological activities also. So these are the these are the bioactive compounds which I have discussed here. They are actually the chemical constituents are varied in during the processing of garlic, and they are biologically how they exert the biological activity. Now, what are the different health beneficial effect of garlics? I'm going to discuss. So garlic have effect as an anti-inflammatory activity because garlics and its sulfur-containing compounds exert anti-inflammatory properties through the inhibition of those anti-inflammatory mediators. During in Here, actually, there is an incorrect. Here, inflammatory mediators, it should be during in vitro and animal studies. So, in there are one study, case study here I have given that daily dose supplementation of 1 gram garlic tablet for 12 weeks significantly improved from stiffness, pain, and physical function. This stiffness, pain, and physical functions are basically due to the inflammatory mediators, and because it helps to inhibit those inflammatory mediators, and that's why the joint it reduce those pains, and in overweight or obese men with osteoarthritis. Okay. This garlic also showed antithrombotic and anticoagulant properties, and this antithrombotic and anticoagulant properties is directly related with the maintaining the cardiovascular health. Garlics also showed hypoglycemic activities, and that's why garlic can reduce the blood glucose level. There is the study found that in the rats, actually, the study has been done, and with a high dose of 500 mg per kg of raw garlic, blood glucose, cholesterol, and triglycerides were markedly affected. It has been found that the bioactive compounds are basically associated with those activities are garlic oil and diallyl trisulfide, which is actually the after decompositions of allicin in the presence of water, this diallyl trisulfide is basically produced. So it is basically responsible to improve the glycemic control in diabetic rats, so increased insulin secretions and increased insulin sensitivity. Already I have told that the insulin is basically improper working of insulin is basically associated with the blood sugar level, increase in the blood sugar level, and that's why this garlic actually help to increase the sensitivity of insulin. Apart from garlic also showed immunomodulatory activity. That means it enhanced the immunity of the any animals or human bodies. So how? Because it actually the immunomodulatory effects is basically due to it stimulates the lymphocyte proliferations, interferon gamma release, enhancement of macrophage phagocytosis, and killer cell activity. And all those activities basically due to the garlic exhibit antibacterial and antifungal and activity, and therefore it has a immunomodulatory activity. Now another spice, that is cinnamon. Cinnamon is another third most popular spice which is considered by the population that it promotes the health and wellness. So main components are present in the cinnamons are essential oil, cinnamaldehyde, cinnamic acid, cinnamate, that is bark oil, 60 to 80% present, and eugenol and other some water soluble polyphenols are present, and some flavonoids are also present, and that is proanthocyanidins and oligomers of cinnamatannins. These are all bioactive components which are responsible for exhibiting those bioactivities. So health beneficial properties of cinnamon is it showed antibacterial and antifungal activity, and basically it has been shown to attack major respiratory and gastrointestinal tract pathogens. So it helps in cold flu also, and also help in different gastrointestinal diseases which is related to pathogens. So cinnamon may beneficial effects on chronic salmonella infection. Salmonella infection is one of the food poisoning infection. Apart from those infections, it has been showed, the study showed that it's have some bactericidal activity against Helicobacter pylori. This is, but it is actually, there is a lack of evidence to support the use of cinnamon for Helicobacter pylori infection suppression. Another health beneficial effect, that is the blood sugar control. Cinnamon can actually decrease the fasting plasma glucose levels, and thus it's helpful to those patients which are suffering from type 2 diabetes. In human studies, it has been shown that cinnamon supplements of 3 gram per day or more had improved glucose control and insulin sensitivity in both healthy and diabetic subjects, and the bioactive compounds which is responsible, that is proanthocyanins. Another health beneficial effect, that is the hepatoprotective effect. This cinnamons has been known to reduce the fatty liver because it has been the study showed that ethanol extract of cinnamon showed hepatoprotective effect action against carbon tetrachloride induced lipid peroxidations and liver injury in rats by elevating the antioxidant enzyme activity. So antioxidant enzyme activities, it increase by enhancing the antioxidant enzyme activities. It reduce the the fatty liver, or it protect the liver from acute alcohol induced fatty liver. It also showed a neuroprotective property. One of the most common older disease, that is Alzheimer disease. It is basically a neurodegenerative disease and caused by tau protein, that is a protein that becomes toxic when it accumulates and twists inside nerve cells in the brain. And apart from that, another protein is the amyloid beta protein, which is also known as a beta peptides into the neurotoxic oligomers, and these are actually trademarks of Alzheimer disease. And this cinnamon, it has been shown that these cinnamons inhibit those proteins and help to treatment of patients which are suffering from mild to moderate Alzheimer disease. Now, another one of the most recent you can say the recent research spice is turmeric, because turmeric has numerous health beneficial effect. This golden color spice is very popular among the researchers because it showed chemopreventive effect. So, turmeric, the main bioactive compounds which is responsible to exert those biological activities are curcumin, and this curcumin is the active compounds, and the color of yellow color is mainly responsible. Yellow pigment or yellow color of turmeric is mainly due to the presence of curcumin. Apart from curcumin, the other curcumin derivatives are also considered as the bioactive compounds that are curcuminoids, including curcumin, D-methoxycurcumin, bis-D-methoxycurcumin, and tetrahydrocurcumin. So these all are actually considered as the bioactive compounds which exert the biological activities. Turmeric as antioxidative and anti-inflammatory effects. Already I have said antioxidative effect, it means that it have a capacity to scavenge the free radicals. So free radicals are scavenged inhibited lipid peroxidations and LDL, that is actually lipodensity protein, low density lipoprotein, sorry, that is bad cholesterol, oxidation and prevented deoxyribonucleic acid oxidative damage, and therefore it actually prevent many types of diseases. Apart from that, it also exhibited a powerful anti-inflammatory effects, possibly by inhibiting those inflammatory mediators. The one case study here I have given, that is shown that curcumin supplementation, that is daily dose of 1 gram per day over 8 weeks, which significantly reduce the serum concentration of pro-inflammatory cytokines. So curcumin is act as also helpful on those inflammatory diseases also. Turmeric is also helpful to maintain the gastrointestinal health, and it is found that the effect of the turmeric extract is actually effective on irritable bowel syndrome. Administrating a dose of either 72 or 144 mg turmeric extract for 8 weeks, which reduce the pain or discomfort, and that is related to the irritable bowel syndrome. Apart from that, it also helps in brain health and cognitive functions. That is preventing the accumulation of beta aggregations, which I have discussed that beta protein is also associated with the trademark of Alzheimer diseases, and so it is an important factor. Because to prevent those beta aggregation is very important factors to maintain a healthy brain function. And this curcumin enhance the beta clearance and reduce the beta and plaque burdens in animal studies, and thus they actually help in brain health. And it has another study shown that curcumin improved the memory retention and prevented different oxidative damage which is related to brain. It also help in maintain the joint and muscle health because they have anti-inflammatory effect, and therefore it reduce the pain of joint and pain of joint and stiffness also. So here two study I have given, that is the study showed that turmeric extract containing 41% curcuminoids, that is the curcumin derivatives, which was effective in preventing joint inflammation in rats. Another suggested the patients with primary knee osteoarthritis who consumed dose of 2 gram per day turmeric extract for 6 weeks had a similar pain relief as the patients who consumed 800 mg per day of ibuprofen. So it is actually painkiller, so it is a similar effect of the consuming turmeric with ibuprofen. Another that is the most research topic, and that is the chemoprevention effect. It has been seen that curcumin inhibit the proliferations of various tumor cells in culture, prevented carcinogen-induced cancers in rodents, and inhibited the growth of human tumors in various models. And here I have shown one case study I have shown, and that is curcumin inhibits the growth of breast cancer through inhibiting cancer cell proliferations, promoting apoptosis, and inducing the senescence by means of targeting multiple cell signaling pathways and transcription factors. So this apoptosis is very neat for the cell that is to kill the cell, you can say. So curcumin, this actually inhibits the growth of curcumin act as a chemoprevention effect. Okay, so these are the actually health beneficial effect of turmeric, which and we have actually learned about the different spices, what are those bioactive compounds, and what are the health beneficial effect basically for ginger, garlic, cinnamon, and turmeric. Okay, thank you.